Hi, welcome to another episode of Youth Diary. Cancer begins in our cell, which are the building blocks of our body. Today we are going to discuss about the gynecologic cancers. And to help us, we have Dr. Manoj Bapu with us. He is a gynecologic oncologist at Kinder Hospital, Cherthala. Hello doctor, welcome to our show. Doctor, can you just explain what is a gynecological cancer?
Gynecological cancer includes all tumors which involve the female genital organ. That means the uterus or the womb where the baby grows, then the lower part of the uterus or the neck of the womb that we call medically as cervix, then the ovaries where the eggs are formed, and finally the tubes which connect the ovary with the tube, I mean the uterus. And also rarely we get cancers of the birth canal, that is the vagina, and also the external genital organ, that is the vulva. But the common ones, as I have told, it's the uterus, the cervix and the ovaries.
We'll go to the questions.
All right.
Hello ma'am, I'm Gayatri Vijay Kumar, second year MBBS student from CMC Kochi. My question is, what is the chance of getting gynecological cancers? Is it related to lifestyle?
Okay, gynecological cancers are very much related to lifestyle, even though that contributes only to a minority, because the main factor is genetic and environmental factors. So to coming to the lifestyle factors, one is the overweight. So those who are overweight have roughly around say 10 times more risk than those who are of normal weight to get cancer of the womb or the uterus. Similarly, say if you have a healthy sexual life, your chance of getting cervical cancer comes down drastically, because 99% of the cervical cancer of the neck of the womb is caused by a virus which is transmitted sexually. Then comes the importance of dietary factors, like you should have a healthy diet rich in vegetables, fruits, and you should have regular exercise, as I have told earlier, to maintain a good weight. Also, it's important to have a regular checkup with your doctor and do a pap smear. That is one test which is quite reliable in detecting cancer of the cervix even before it starts. So that's important. And finally, it's important to get vaccinated as well. So that is something which can prevent this infection, as I have told earlier. Then many other cancers of the like the ovary and all are not much related to your lifestyle. And finally, having children, that's very important. Like have your children at a young age, like say in the 20s before you cross 30s. If you complete childbirth and have 2 children or 3, you lower your risk of chance of getting gynecological cancers. And also it's important that you breastfeed your babies. So these are the steps probably you can take.
Doctor, how do they present? Symptoms.
Symptoms. Yes, ovarian cancer is something which I would like to tell. It is present with all non-specific symptoms. So that is something which you cannot. So any change in your day-to-day change in your tummy, any new pain which lasts for more than 2 weeks, or any abnormal bleeding which lasts for more than 2 weeks, or change in your bowel or bladder habits, you have to report your doctor. And about cervical cancer of the neck of the womb, it presents with bleeding, especially after sex. As I have told, these symptoms again will present only at a later stage. So screening is very important. Early detection is more important than mainly it's abnormal bleeding.
Okay, Dr. Ipam, you have told about pap smear.
Yes.
How frequently do we have to go for that?
Pap smear, the present recommendation is to start at the age of 21 and do it every 3 years till you are 30, and thereafter every 5 years till the age of 65. When we put it in the Indian situation, like even if you do it every 5 years, that will be fine.
That is
it's arbitrarily taken as 21. Once you become sexually active, it is recommended to go for pap smears.
Okay.
Yes.
Okay, doctor, we'll see the questions.
My name is Fatima Salim and I'm from CMC Kochi. And my question is, one of my classmates is having a tumor in the ovary, and as advice for surgery. And is it a cancer? And can she have children in future?
When you told your classmate, I presume that she is not married. So any tumor or any lump on the ovaries, say if it's more than about 8 centimeter, or if it has lot of solid areas when you do scan, or if there are thick septae, or if the scan shows that it has abnormally increased blood flow, generally it is good to go for surgery. And surgery doesn't mean that taking away the reproductive capacity. Most of the time, the type of cancers which are, I'm not telling that this is your friend is having cancer. Even if it is cancer, at your age, what we get is a special kind of cancer known as germ cell cancers, and they are quite well treatable and curable. Like most often, we can get away by removing only the ovaries or part of the ovaries, only on one side, and you need not remove the other ovary tube as well as the uterus. So in that way the fertility can be preserved, and even if it is cancer, as I have told, you can give chemotherapy after the surgery, and they can as well have children, as I mentioned.
Other than this surgery, is there any medical treatment for?
Surgery is the first line of treatment in these situations, because directly going for a medical treatment or chemotherapy is not recommended. First of all, you don't have a diagnosis unless you do surgery, and for ovarian cancer, always once you do surgery, you are removing the tumor, and also you are doing a staging to see whether it has spread to any other areas. And most of the time, if it's a well localized tumor within the ovary, you don't need to go for any further chemotherapy. And in such situation, you will be over treating them by giving chemotherapy, of course, which does have side effects. So chemotherapy is only as and when required.
Like how long we have to go for a chemotherapy?
Generally, it's for usually 6 cycles, but it varies from depending upon the type of cancer, the individual's stage of the disease, and the response to treatment. Sometimes even if you plan for 3 cycles or 6 cycles, if we see that the patient is responding with 2 or 3 cycles, we may have to switch to another type. So it's variable.
Okay, doctor, does it run in families?
Ovarian cancer, yes, it does run in families. Roughly 10%. That is, 1 in 10 cases of ovarian cancer is familial or it's inherited. And then those are the ones which are found in much younger age group, and especially those who have close family, first degree family relatives like your mother, sister, father or brother, like those. If more than 2 of them have either breast or ovarian cancer, you need to check you need to go for gene testing to detect whether you have any abnormal genes.
We'll see the next question.
Hi ma'am, I'm Ruby Fatim. I'm a second year MBBS student studying Kochi Medical College. I have read in magazine about cervical cancer vaccine. Is it really effective, and what are side effects?
Cervical cancer vaccine is a wonderful drug which has come up in the last few years. It's very effective. Like you can prevent up to 70% of all cervical cancers if you get all the 3 doses of this vaccine. And as I have told, up to 30% cancers cannot be prevented, because this vaccine is focused, or it fights against certain type of human papillomaviruses which cause 99% of all cervical cancers. So there are 2 types of vaccines presently available. One is one fights against the 2 most common type of cancer causing human papillomaviruses. The other one fights against 4 type of viruses. So these are the common viruses. So sometimes cervical cancer can be caused by some other viruses as well. So this is recommended at around 11 to 13 years for all girls, and you can come down even up to as low as 9 years, and the upper limit of recommended age is 26 years. So in our Indian scenario, especially when our girls become sexually active at a later age, so you can even give it as I've told, maybe 16 years or 18 years at any time. So it's quite effective. And you've also asked about the side effects. Side effects are quite very rare actually, and even if side effects occur, they are pain, some dizziness, and some headaches kind of things. It doesn't cause any serious side effects. And about the long-term studies about this vaccine, we have got data about 6 to 7 years. There is the studies have shown that the immunity against the viruses have not come down at all after 6 to 7 years of follow-up. We need to wait for some more years to get more data about it.
Doctor, how many doses we have to take?
It is 3 doses, which is given at an interval of about 3 to 6 months. Once you complete the 3 doses of vaccination, you can expect to have a lifelong immunity. So that is what we know at present.
It protects only the cervical cancer. It prevents
It does. As I told you, there are two vaccines. The one which the quadrivalent vaccine also protects against certain non-cancer tumors like genital warts. So they are also helpful in preventing these as well.
Okay.
Yes. And another interesting fact is that even in Western countries, people even give it to boys, because sexual transmission, if you prevent boys getting human papillomaviruses, you can as well prevent it getting transmitted to girls.
That means it's a sexually transmitted.
It is definitely a sexually transmitted disease. Yes.
Okay, we'll see the next question, doctor.
Hi ma'am, I'm Ida Mary from CMC Kochi. I've got a question. My friend has severe pain during her periods. The scan said that she has endometriosis. So what's the best treatment for her?
Endometriosis is something which is very common nowadays. That is basically the lining of the inside lining of the womb or the uterus happens to be on the sometimes on the ovaries and rest of the the lower part of your abdomen. So when you get periods, it will bleed in the abnormal location and you get pain. So as your friend is having endometriosis, but I presume that she's not married. So presently it is better to go for any medical treatment. First of all, good painkillers at the time when she has periods, and if it's not getting control with that, she can go on hormone tablets, say for a period of 3 to 6 months. And one suggestion which I have for her is to get married as soon as possible and maybe plan your childbirth. And at any stage, if she finds it difficult to conceive, she can as well go for surgery. And so surgery is recommended primarily for those who have already married. And immediately after surgery is the best time for her to conceive. And again, repeat surgery is not advocated, because each time you do surgery for endometriosis, you are damaging the ovaries. So that will have an impact on your future childbearing capacity.
Doctor, this endometriosis, is it related to cancer?
Not really. Endometriosis as such is not cancer. It is not abnormal. It is the normal endometrium which is present in abnormal location. So it doesn't multiply very fast like cancer. But there are a few type of cancers which can occur in a pre-existing endometriomas, but that's quite rare. So the primary concern about endometriosis is the pain as well as the difficulty to become pregnant, and the long-term implication is that it will affect the overall emotional function of the patient, and sometimes they may need to undergo hysterectomy. So it is not related to cancer.
Doctor, our next question.
Hi ma'am, my name is Bensi Joseph and I have a question please. I have heard that the cancer can be cured when it is detected at early stage. What are the available options for the detection of gynecological cancer?
So as you have rightly asked, prevention is probably the best way to fight cancers. So as far as gynecological cancers is concerned, the only cancer which can be very effectively prevented is the cancer of the neck of the womb or the cervical cancer. What we recommend is a pap smear, which I have already told. Like, you take a small smear, that is, you rotate a small spoon-like, wooden spoon-like thing just beside your cervix, and whatever you get, you put it on a slide and send it to the doctor, the pathologist, for to have a look under the microscope. From this only you can detect what we call as precancers. So precancers are something which over a period of time can progress to cancer. So once you detect precancers, you can we can treat by just removing that small portion of the cervix by an operation which doesn't even require an anesthesia. So the recommendation, as I have told, is start doing it once you become sexually active, say after 21 years, do it every 3 years till you are 30, and thereafter every 5 years till the age of 65. Then coming to other cancers, like next is ovarian cancer of the ovary. We do not really have a good test so far to detect it early. So you be aware of yourself, you know about your body, and if any new symptoms like any pain or aches in your abdomen or the tummy, or if any change in your bowel or bladder habits, as I have told earlier, you report to your doctor and get a gynecological evaluation as well, because it's very non-specific. Then there are some studies going on in Western countries, like doing an ultrasound scan every year, and doing a blood test known as CA-185, and whether it can help us to detect ovarian cancer. But they are quite expensive and it's not practical to do it on a large scale. And coming to uterine cancers, most of the time uterine cancers present at very early stage with abnormal uterine bleeding. So many times we don't have a problem, like they don't present in advanced stages, and even if at all uterine cancer, most of the time you can treat it very effectively and it is almost 100% curable. Then vulval cancer, again the cancer of your external genitalia, there are no effective screening tests. Again, since it is outside, any changes, any small ulcers which doesn't heal or any persistent itching, anything you have to report to your doctor to detect it early. So again, to sum up, the only effective cancer which can be prevented is cervical cancer is by doing a pap smear on a regular basis.
Doctor, we have got a mail.
Okay.
It's from Kasaragod. One of my aunties have a huge lump in the uterus. The doctor said it's as big as a 5-month pregnancy and advised for an open surgery. Is it okay to have a keyhole surgery?
Yes, it's quite possible. Like a lump in the uterus, the commonest one is fibroid uterus, as many of you might have heard about. So 5 months of pregnancy is like, it's almost just below your belly button or your umbilicus. So it can very well be tackled by laparoscopic surgery. Only thing is that you may have to remove it laparoscopically using a special instrument known as smossulator, or partially it can be removed from down below, that is vaginally. The only situation where you need to think of an open surgery is when we suspect cancer. So since if the scan finding or if there is no clinical suspicion of a cancer, you can go for keyhole surgery. It's quite safe, and generally size is not a big problem with laparoscopy. As long as you can visualize it well with your camera, you can do a better job with laparoscopic surgery than open surgery because of the better visualization and the magnification you have. I think I made it clear.
And how do they do this laparoscopy surgery? You said like a 5-month, like as big as
yeah,
a 5 month.
5 months, as I've told, it's below usually laparoscopes are put in the belly button or the umbilicus, but for bigger tumors we go much above that and we can put in the scope, and basically the laparoscope is basically a camera. So to see it a big tumor, you have to go a little farther. That is the basic thing. So as long as you can have a good visualization, you can tackle any size laparoscopically. The only problem is, again I stress, the good visualization, and anything else can be handled.
No, doctor, like how do you remove this big car?
Yeah, that's why I was trying to tell you, like there are 2 ways of removing it. Either you have an opening, natural opening below, that is a vagina. Once you are removing the uterus, you can remove it vaginally. And sometimes you may have to reduce the size using a special laparoscopic equipment known as smossulator. So that with that you can reduce the size of the tumor, and remaining you can remove from vagina by cutting it.
So that means, doctor, she can go for a keyhole surgery?
Yes, obviously, because see, if you do a laparoscopic surgery, usually what we do is we discharge the patient the very next day. So that's quite, the recovery is quite fast. So for a big tumor, in fact the advantages are more in a bigger tumor, because you need a bigger cut to remove a bigger tumor if you do open surgery. But with laparoscopy, she will have a very small cut like any other laparoscopic surgery for this big tumor, and she will be happy at the end of the day.
How many days rest she has to take?
After open surgery we tell say 2 to 3 months rest, but laparoscopic surgery I usually tell my patients to restrict their activities for the first 1 week and do not do any hard work for another 1 month, because they only need to have a good healing of all the pedicles or the vessels leading to all the organ which we have removed. Otherwise it doesn't take much time for the wound on the abdominal wall to heal.
Doctor, it was really informative. Thank you so much for spending your valuable time with us.
Thank you so much.
So friends, write your suggestion to us. Our email ID is youthdiaryrosebowl@gmail.com. See you next week.